Woman from Michigan, Ms. Tlaib, is now recognized.
Thank you so much, Chairman. Thank you so much, Director Chopra. I want to talk about something that my residents are actually asking me about specifically. Of course, CFPB has been incredibly responsive with a number of fraudulent cases, issues that are coming up with folks' credit card companies. So I appreciate your team and your staff being so responsive to my team. They really are getting callbacks and feeling like they have an advocate in the CFPB. As you know, nearly 1 in 5 Americans, American adults, are burdened with medical debt. And this is something that I've been continuing to talk about with many of my colleagues here. You know, I feel like it's completely wrong to have medical debt weighed down on credit reports. And you and I know no one chooses to get sick, and I know you have personal stories yourself. But medical debt should not prevent somebody from securing a home or even education, basic needs. I've even had residents talk to me about the fact that they had to sell their home because of medical debt, or get another loan on their home because of medical debt. In my own district, we've had residents who are veterans, seniors, report challenging, just difficulty in paying $3,000 to $4,000 in medical bills, and then they're on a fixed income. And these are folks, by the way, that get their stuff garnished. They go after them, and these are people that are actually insured. Let's understand, they're not uninsured. They're actually folks with health insurance that are still facing a high burden of medical debt. And so for me, I was so incredibly excited that CFPB announced a rulemaking process to remove medical debt from consumer credit reports, which I also called for, you know, in my Restoring Unfairly Impaired Credit and Protecting Consumers Act. And so, Director Chopra, can you describe, because I think it's important for my colleagues, really, if listen to this, this is important, because even Chairman McHenry talked about the fact that he paid his bill and it still showed up, and the inaccuracy of debt that is showing up on people's credit report. I mean, collections are inaccurate, things are already paid, our medical service that occurred many, many years ago are all of a sudden appearing from decades prior on people's credit. It's really unbelievable, the stories that are coming from many folks. So can you describe some of the billing and collection practices that motivated CFPB to take action?
Well, what we saw is that the largest item of delinquent derogatory items on a credit report was no longer credit cards, no longer a normal loan. It was allegedly unpaid bills. And the very common experience was people say, I'm disputing this is wrong. And then they go through this endless paperwork process to do it. And we know this is not like a normal loan. This is a situation where there's a back and forth between the insurance company, the provider, the facility, and we have found very serious inaccuracies. And I think it has just raised the question about, given its limited or almost no predictive value in cases, is the credit report just a way to coerce someone to pay something they don't owe?
Exactly. And, I think you led a little bit on this, but your own research in CFPB found that using medical billing data on a credit report is less predictive of a credit risk or performance than non-medical collection. So there's no, I think, benefit in having medical debt be, on credit reports and weighing down on so many of our families that, from cancer to even folks that have, really awful car accidents and lead to so much health benefits, including physical therapy. Folks told me that they have insurance, but it didn't cover, and years later they're getting all this stuff showing up on their credit report. There's something that I talked to you about, and I really want to take a moment, and I know you may not have coverage over, but right now auto insurance companies are using non-driving factors, Director, and I talked to Secretary Yellen about this morning. It really has had a disparate impact on my residents. I mean, using the credit scores, marital status, education level. I just feel like that practice is a way to discriminate, especially when I see folks with DUIs but high credit score paying 3 times less than somebody with no DUI and a lower credit score. And I wanted to see if you had anything to say about that.
Yeah, well, you're right. We don't regulate insurance, but I think there are serious issues with how credit scores are being used sometimes. For many people, it just doesn't seem to make sense. I don't
know. Somebody with a PhD, Director, is going to be a better driver. I don't understand the rationale that auto insurance companies use in this data.
Well, I think sometimes they'll say whether it's going to be their premium is going to get paid, but sometimes it's so variant. And again, we don't have authority over here. We just cover the credit report and credit score. But Certainly, if Treasury's Insurance Office does further work on this, we're happy to provide, information on it. The state insurance regulators, I know many of them are also wondering the same question.
Yeah, some states have done that, but thank you so much, Chairman. I yield.